Good morning, everyone. This is Sarah Kirch, the director of the Wisconsin Cancer Collaborative. We are thrilled to have you today join us for our monthly networking webinar, where we will unveil the Wisconsin Cancer Plan 2020-2030. Because it's 10 o'clock, we will go ahead and get started just to make the most use of your time. We know you're all very busy. Before we get started, I have a few housekeeping notes to share. This call is being recorded. If you're experiencing technical difficulty, please use the chat for assistance or the help options right within Zoom. All lines have been muted, but if you could do so, make sure that you mute yourself as well. Otherwise, we'll have people in the background trying to find anyone that might be producing background noise. As a reminder, each month we hold monthly networking webinars on the second Thursday of each month from 10 to 11 a.m. Previous recordings and upcoming webinars are all available on our website. If this is your first webinar, we hope to see you in future months. For those that might be somewhat new, the Wisconsin Cancer Collaborative is a statewide coalition of 140 organizations working together to reduce the burden of cancer for everyone in Wisconsin. Staff work to connect members to each other and provide them with the tools, support, and knowledge they need to create healthier communities. Today's webinar will provide a brief overview of COVID-19 in Wisconsin by Dr. Mark Wagner with the State of Wisconsin's Division of Public Health, the unveiling and review of the Wisconsin Cancer Plan 2020-2030, both in a print PDF form as well as the interactive online plan. Remarks from our chair, Dr. Melinda Sally of the Medical College of Wisconsin, and Gail Johnson of the Wisconsin Well Women Program and longtime member of the Wisconsin Cancer Collaborative, and a discussion led by our very own Beth Brunner, Partnership Manager for the Collaborative. If you have questions throughout, please enter them in the chat or save them for the discussion portion of the webinar where you'll be able to unmute your line. Because COVID-19 is still so prevalent and something really that we're all facing, we want to continue to provide information to all of you about COVID-19 as a resource to all of you. So I would now like to introduce Dr. Mark Wagner. Dr. Wagner serves as the Chronic Disease Medical Advisor within the Division of Public Health at the Wisconsin Department of Health Services. In addition to answering questions you may have about COVID-19 and chronic disease, including cancer, Dr. Wagner will provide us with a brief update on Wisconsin's COVID-19 numbers. Dr. Wagner?
Thank you, Sarah, and thanks for having me back again this month. So yeah, again, I just wanted to update on where we stand as far as cases and the picture of coronavirus disease in Wisconsin. So we continue
Sorry to interrupt, Dr. Wagner. You are breaking up just a little bit. I don't know if...
Let's see. I'm sorry. I made sure not to do Wi-Fi. I'm on a direct connection, so hopefully, is that any better? I can try to...
Yes, you're sounding okay to me, Mark.
Okay. Maybe I'll just try to speak up a little bit more. So the Department of Health Services continues to provide daily updates on COVID cases in the state, and that's updated at 2 o'clock every day on our website. And you can see the link at the bottom of the slide to show how you can directly access that data. And it's constantly evolving. They're adding different ways of looking at the data, looking at regional information. You can look at a variety of different things with the data sets that are there. And so as of the information that was added yesterday at 2 o'clock, we have about 62,263 confirmed cases, a little over 1,000 deaths, and about 5,125 hospitalizations. And one thing that, as I keep doing these monthly check-ins, I like to look back and see the data as we did a snapshot in previous months. And if you look at where we were last month, for last month's webinar, we were at 33,000 cases. So we've almost doubled in the last month. Before that, we had been about 21,000 the month prior, and then 10,000 the month prior to that. So the last time we were seeing doubling was more early on in the outbreak. So it's just of note that we continue to see cases on the rise. Next slide, please. And to sort of drive that home a little bit more, this is a map that we've shown a number of times over the course of presenting these numbers at this webinar. And you see in April, we had some pockets where there still were not cases, and now we can see that it's spread throughout the state. There are no areas of the state that are immune to this, maybe rural areas that didn't have as much spread early on, just based on the fact that there aren't as many people in those areas, are now seeing cases as well. So there is activity throughout the state, so that's important to note. Next slide, please. And again, another thing, an unfortunate thing that we've continued to note every month is that we do see that disproportionate impact on Black and Hispanic or Latino populations, where you can see the proportion of the population for each of those groups is not reflective of their burden of cases and deaths. So in the Black community, twice the number of cases based on population percentage of what we would expect, and about 3 times the number of deaths based on population percentage. And with the Hispanic and Latino community, about 3 times the number of cases and more deaths than we would expect based on the population as well. So that's, again, just shows some underlying health, social and economic disparities that just have been more unearthed or have been more exposed by the pandemic as well. So looking at the next slide with again, to kind of give context is why do we keep presenting this at the cancer webinars? Well, it's important to remember that we want to reduce the spread of COVID-19 to help cancer patients as well. Certainly they fall into an immune compromised group that would be at higher risk of worse outcomes. So we're trying to protect immunocompromised cancer patients and their caregivers. We are looking for ways to make sure to get the messages out that there are safety protocols in place for people to make sure to get the testing and screening that they need, and any cancer prevention vaccines as well. Because I know it still remains a concern amongst high-risk individuals to be out in public a lot, and so we want to make sure that people understand that healthcare systems have safeguards in place. But again, the best that we can do is to start reducing the spread so that this is not as much of a widespread issue. And we also know that one of the things that makes for better outcomes is if people have healthier weights, and we want to make sure that people have the safe spaces that they can exercise and do all the things before that kind of lead to healthy lifestyles. So the sooner we can get on top of all of this, the sooner we can see things start to improve throughout the state. And one of the ways that we're trying to do that is through the statewide mask mandate, which went into effect August 1st and continues through September 28th. So basically this is to wear a mask when you're unable to be socially distant from people outside your household. And that's critical to reducing the spread. So we've seen even more evidence of that as the research comes in on how important it is to do that and how quickly we could start to get better control of the disease spread if we would do that. And we also have the links to some other resources, and you can see the website that's listed on there that can help you with any issues that you have with respect to cancer and COVID-19. So with that, I see there is a question, but I don't know if we're going to wait till the end to do those, or if you want me to address those now. Otherwise, I will wait until the end to do the questions as well. Oh, and I see you pulled up the slide, so you can see right there the cases for Hispanic and Latinx population. So the number of cases is about 3 times what we would expect on a population level, and there certainly is an increased number of deaths from their percentage in the population. 11.7% of deaths and 23.1% of cases versus 7.1% of the population being Hispanic or Latinx.
Thank you so much, Dr. Whitner, for that information. We really appreciate it. And Dawn, thank you so much for that question. We appreciate it. There, again, will be opportunities to ask questions at the end as well. We are going to shift gears now to the unveiling of our new Wisconsin Cancer Plan. But first, we wanted to provide a little summary of comprehensive cancer control as an approach. Comprehensive cancer control is a national approach funded by the Centers for Disease Control and Prevention, or CDC. Grantees include states, tribes, and territories. Every state has a comprehensive cancer control program and coalition. Grantees are charged with convening partners, most often in the form of a coalition, to determine the impact or burden of cancer in their specific geographic area, establish a blueprint or a plan to reduce the identified burden, and ultimately take action on the blueprint. In Wisconsin, we follow the national approach and framework closely. The cancer burden in Wisconsin is determined by many data sources, but primarily through data found in the Wisconsin Cancer Reporting System, which provides the number of new cancer cases by cancer site, as well as deaths by cancer site. We also get information about cancer 5-year survival rates through the Wisconsin Cancer Reporting System. Other important data sources, such as the Wisconsin Immunization Registry and Behavioral Risk Factor Surveillance System, provide important context about the burden. The Wisconsin Immunization Registry provides important information about hepatitis B and HPV vaccination rates, and the Behavioral Risk Factor Surveillance System, a telephone survey, provides a number of data points for us to understand how Wisconsinites are, or perhaps are not, taking steps to reduce their risk from getting cancer and being screened for cancer, as well as access to healthcare and the unique needs of cancer survivors. Data on that cancer burden is then provided to our stakeholders, the majority of whom are Wisconsin Cancer Collaborative members, to create the blueprint to reduce the burden of cancer for everyone in Wisconsin. That blueprint, or the Wisconsin Cancer Plan, is created and incorporates evidence-based activities and promising practices. It spans the entire cancer control continuum, from risk reduction and prevention all the way to end of life. And it's ultimately the responsibility of our state and membership to implement together to make progress in reducing the impact of cancer. Work on the Wisconsin Cancer Plan 2020-2030 began with the leadership of our 20-person steering committee in September of 2018 and continued through their guidance along with membership and expert input through July 2020. Lengthy discussions and input sessions took place in person, back when in-person meetings were still possible pre-pandemic, in June 2019 and October 2019. An important change to recognize with the Wisconsin Cancer Plan 2020-2030 is its 10-year span. In previous iterations, the cancer plan would span 5 years. Realizing the tremendous amount of effort needed to create a strategic plan while also needing to take action, the steering committee made a strategic decision in determining a 10-year plan with the opportunity for regular revisions was the best approach moving forward. That said, change requests to the Wisconsin Cancer Plan, due to evolving evidence, recommendation, and best practices, are welcomed at any point and can be submitted online, and I'll show exactly where shortly. Revision requests will be reviewed by steering committee members on a quarterly basis to determine what revisions will need to be incorporated. And I realize this slide is nearly impossible to read, but it's because we have so many contributing organizations to the Wisconsin Cancer Plan. This also appears in the print version, which I'll be reviewing shortly as well if you'd like to review in more detail. We thank everyone who gave their time and expertise to the development of the new 2020-2030 plan. We really could not have created it without all of you. And I would just like to take a moment to briefly say thank you to the team I work alongside every day. They put a tremendous amount of time into distilling feedback from members and reviewing the evidence to come up with this final project. It was really, truly a team effort. Without further introduction, I'd like to provide a virtual drum roll for our Wisconsin Cancer Plan 2020-2030. Here you'll find the printed version of our state's plan with 3 intertwined but distinct landscapes that reflect the beautiful yet distinct areas of our state. From top to bottom, you'll find the urban skyline of Milwaukee, the beautiful waterfront in Door County, and a rural agricultural landscape highlighting the gifts our state's previous glaciers left behind. The vision is a healthier Wisconsin by reducing the burden of cancer for everyone, which is very similar to previous versions with the addition of for everyone to highlight a greater emphasis on equity. The mission shows how we will accomplish this vision to engage diverse partners to develop, promote, and implement a statewide comprehensive approach to cancer control. 6 overarching goals were established by the steering committee and used as a frame to build out the remainder of the plan. Goal 1, advance health equity as it relates to cancer, is a new addition, whereas the other goals are slightly revised from previous iterations of the plan. The 6 other goals include reduce the risk of developing cancer, detect cancer at the earliest stage possible, reduce the death and suffering from cancer, improve the quality of life for cancer survivors, and improve the quality of use of cancer-related data. In addition to the goals, the cancer plan uses a policy systems and environmental change approach to address the cancer burden. We know that healthy behaviors don't happen on their own. Rather, they're shaped by the policies that govern our communities, organizations, or systems, and the physical and social environments in which we spend most of our time. When these types of change occur, they can create lasting health improvements for everyone. For example, a teenager is less likely to smoke when a community enacts a law to limit youth tobacco access. A parent is more likely to vaccinate a child to prevent HPV infection when a medical provider recommends a vaccine, and the medical provider is more likely to recommend vaccine when a reminder system is in place within the health system he or she works. A family is more likely to get the exercise they need when their neighborhood includes safe sidewalks and parks. There are 2 places to find the Wisconsin Cancer Plan, both a PDF printed plan and an online interactive plan. In both, you'll find 7 chapters with priorities and strategies to address each chapter. You'll also find important background and takeaway points for each chapter and important key terms. The interactive cancer plan, though, includes a few more details. The interactive cancer plan includes more granular activities or action steps to implement the plan. The online version also includes how the plan progress will be measured, which will allow us to routinely update measures with the latest data to show trends. And finally, the online plan includes related resources connected to our new resource center to help take action in specific areas. The 2020-2030 plan includes 7 chapters. Chapters 2 through 6 span the cancer care continuum from risk reduction through end of life, with 2 very important bookends, Chapter 1, Health Equity, and Chapter 7, Data. Given the different features of the online and print plan, we'll go through Chapter 1, Health Equity, in the print plan, and we'll then give a tour of the online version of the plan. But before I dig into the chapters, I do want to share a quick note about how to learn more about the plan and get your hands on the print plan. We'll give you links to review the PDF and online interactive plan at the end of today's webinar, but if you would like a print copy of the plan and to learn even more about how members of the Wisconsin community are implementing the plan, we encourage you to register to attend the 2020 Virtual Wisconsin Cancer Summit on October 28th and 29th. We'll be taking up about 3 hours of each day, realizing that sitting at a computer for 8 hours in one day is quite a bit to ask. So please stay tuned for information about how to register. When registering, you will be asked to provide an address where you can receive mail, so we can send you both a copy of the print plan as well as some new Wisconsin Cancer Collaborative flag. Registration will open later this month, is free, and will include important details. You can, of course, request print versions of the plan if you're not attending the virtual summit, and we'll be sure to provide multiple copies of the new plan at future in-person gatherings, which will certainly, hopefully, be sooner than later. When opening to the first chapter of the plan, you'll find photos, some of which feature many of our Wisconsin Cancer Collaborative members, background and takeaway information, and key terms. You'll also then find priorities with the strategies to address each priority. For Chapter 1, there are 3 priorities. Priority 1 is increased capacity to reduce the burden of cancer for everyone. Priority 2 is increase the number of Wisconsinites with access to quality health care. And priority 3 is increase and prioritize health improvement approaches that engage, center, and benefit populations and communities at highest risk of health-related inequities. And I realize again that this might be difficult to read, but I wanted to point out that pages with the priorities also have a reader's note, pointing readers to the online Wisconsin Cancer Plan for detailed action steps and data measures. So let's go ahead and take a quick tour of the online interactive Wisconsin Cancer Plan. Due to time, I'll only be highlighting portions of the online plan to make it easier for you to browse and interact with the plan on your own. In addition to all of the information in the print version, as well as action steps and measures, the online plan also includes resources to take action in our new resource center, which I will also show. So I will take a moment to switch my screen share. And hopefully that happened somewhat seamlessly. From the home page, you can hover over Cancer Plan and select View the Plan. This landing page gives you the option to either view the PDF or the interactive online plan. We'll select the interactive online plan for now. The online plan has the left menu, which is somewhat to say the plan table of contents, so to speak. The left menu allows you to scroll through the plan's chapters. Each chapter has an overview tab at top alongside the priorities and the measures for each chapter. You can see the list of priorities beneath each chapter overview, which is also a hyperlink that can be used to open the corresponding priority tab. When in a priority tab, you'll find the strategies, also found in the print plan, but you'll also find the action steps for each strategy, only found online. Also, when scrolling to the bottom, you'll find the measures tracked for progress with the specific priority. All measures for the entire chapter also appear at the top of the page for those most interested in the data. Unfortunately, we did encounter a few technical issues in the 11th hour, which we'll be adjusting in the next few days. The hover feature actually only works for chapter 1 at this moment, but will be added and expanded throughout. The hover feature allows you to understand in text form what the target is for each measure, and then also the baseline source. And as a reminder, the measures being online like this will allow us to routinely update them and provide data to you all, more so than we were able to in a print plan. Going back to priority 2 here, I wanted to also show here, there is a little arrow that allows you to actually jump directly or provide a distinct URL to direct people exactly where you'd like them to see on the cancer plan. So if I select this button here, you'll see that the URL up at the top here changes to specifically be strategy A, which you could easily copy and paste into a document to allow you to reference directly. It's a new feature that we found could be helpful for everyone who is collaborating on the cancer plan with others. At the very bottom of the priority page, you'll also find a link to suggest a change feature here at the corner. These suggestions will be, as I mentioned, this is the suggestion box that will allow you to make a change to the Wisconsin Cancer Plan with your name and email as the suggested edit that you're making and the detailed suggestion you would prefer to make. And as our members, you're the first people to see the new online cancer plan. And so no matter how many close reviews or any document received, we know typos can happen. So if you happen to notice an error or would like a change because of varying recommendations or involving evidence, just let us know. You can use this feature at the bottom of the left-hand main menu, or you can reach out to me directly or anyone on the team, of course. When you return to the overview portion of the chapter, you'll find a link to find resources to take action on the chapter you're reviewing at the bottom. See related chapter resources. You can select this link to visit the Resource Center with filter options to narrow your search. The Resource Center will be updated on a regular basis, so come back frequently or feel free to recommend any resources we may have missed. I will now give you all the opportunity, of course, afterwards to review the cancer plan in even more detail, but we'll be switching gears back to the PowerPoint to talk a little bit more about how we plan to take action in this very large cancer plan. Given the comprehensiveness of the plan, how will we possibly accomplish all of this? Action planning will allow us to focus efforts on a few items to accelerate progress in areas of greatest need and need for collaboration. Resources exist to help guide us through this process, such as the 9 Habits of Successful Comprehensive Cancer Control Coalition, which is developed in partnership with CDC and the National Comprehensive Cancer Control Partners. The Wisconsin Cancer Collaborative is, in fact, a comprehensive cancer control coalition, and this document will help guide us through the process. A policy agenda will also be created to support policy activities related to the action areas, as well as timely policy needs that might fall outside action areas, but are still well within the scope of the Wisconsin Cancer Plan. Work begins this fall to develop action areas in the policy agenda under the guidance of the steering and policy committees. Be sure to join October's monthly webinar on October 8th from 10 to 11. Details are featured on this slide where you'll be able to provide input. Registration information is found on the link here, and we'll be able to follow up with you with information on how to register for that. I'd now like to turn our webinar over to Dr. Melinda Stolle, Chair of the Wisconsin Cancer Collaborative and Associate Director of Prevention and Control with the Medical College of Wisconsin. Dr. Stolle will provide a few remarks before our partner presentation.
Hi, everybody. It is such a pleasure to be here and to hear all about the new plan. First, what I'd like to do really is applaud Sarah and the Wisconsin Collaborative staff. The tremendous efforts that they have put into developing and publishing this powerful updated state plan is really just above and beyond the call of duty. And you think that a lot of this was done while living through a pandemic. Many on the staff have small children at home. They pivoted very quickly to create informative webinars for cancer professionals and survivors around COVID and cancer. And really their efforts are truly, truly impressive. So just a moment and a little applaud for their efforts. I also want to thank the steering committee and all the members who assisted in the reviews, and also to those participating in the pre-summit health equity session. These activities were really critical in informing the final product. And third, I want to call attention really to the power of this plan. It is clear, it's concise, it's filled with important information, and it's accessible, which is so fabulous that we can quickly go to it, find things we need. This whole cut and paste option is helpful. It will provide a roadmap for us to effectively address the cancer burden in Wisconsin. And most notably, the plan acknowledges the tremendous disparities that impact so many of our communities and places the responsibility of addressing these in our hands with concrete ways to work toward equity. So despite all the events over the last several months, we all know that cancer continues to impact our families, our friends, our patients, our communities. And I know that along with COVID, we all have a lot of work to do, and this new plan will support these efforts. I think what I'm most excited about is hearing members' reactions to the plans, seeing the creative ways it comes to life. And I want to emphasize that this plan is not supposed to sit on a shelf somewhere or in a folder on our computers. Implementation is really key. And I know everyone on this call shows up each day. You see the burden of cancer, you ease the burden of cancer. But today we have a call to action to go a little beyond what all of us are currently doing. We need to add something new, do something differently, and think about the ripple effect of one small change. Speaking of implementation, so in a little bit, be on your toes. We're going to be wanting to hear from you about your ideas for action and implementation. So start thinking now, as you also pay attention, about how your work demonstrates the plan, how you might extend what you're currently doing. And in particular, I'd like you to consider how you and your organization might leverage the information and action steps presented in the Health Equity chapter. I want to thank you for being here today. I'm so excited about the coming year, mask and all. Oh, and one more thing, please don't forget to put the summit on your calendar. It's going to be a great opportunity for us all to commune virtually, hear more about our plan in action, and find ways to network together to do more. And now what I'd like to do is introduce the esteemed Gail Johnson. She's going to share some of her wisdom, expertise, and action related to her work with the Well Woman program and all she's really done toward working toward health equity in Wisconsin.
Good morning, everyone. And Dr. Stoley, thank you so much for that introduction. And hopefully you can all hear me.
We can hear you beautifully, Gail.
Wonderful. Okay. And again, I want to echo Dr. Stoley's remarks about the wonderful work of the Wisconsin Cancer Collaborative. First of all, I have to say that they have been a wonderful partner for the Wisconsin Well Woman program, so kudos to the entire team. The Wisconsin Well Woman program is part of CDC's National Breast and Cervical Cancer Early Detection Program. There is basically a Well Woman program, if you will, in all 50 states, the District of Columbia, the U.S. territories, the Republic of Palau. So there are about 67 programs that make up the National Breast and Cervical Cancer Early Detection Program. Our primary goal here in Wisconsin is to reduce morbidity and mortality from breast and cervical cancers by increasing the number of low-income, uninsured, and underinsured women who routinely receive screening services. Since 1994, our program has provided breast and cervical cancer to more than 80,000 women in counties and in the tribal nations throughout Wisconsin. Next slide. The backbone of the Wisconsin Well Woman program is our coordinating agencies. We have 13 what we call multi-jurisdictional coordinating agencies. And they're multi-jurisdictional in that they provide service coordination from anywhere from 2 to 10 counties. In addition to the 13 multi-jurisdictional coordinating agencies, we have one local coordinating agency, and that would be the coordinating agency with the City of Milwaukee Health Department. And also, we have the 11 tribal coordinating agencies. And the coordinating agencies, as I said, they are the backbone of the program because they are in the local communities where women live who may be in need of our program services. So the coordinating agencies determine eligibility for the program. And for those of you who may not know, in order to be eligible for the Well Woman program, you have to be uninsured or underinsured. Your income must be at or below 250% of the federal poverty guidelines. So the coordinating agencies work on enrolling women. They work with the providers on case management. They provide provider support. And the other really, really key thing about the coordinating agencies is that they actually, again, in their local communities, do a lot of the outreach and education. We've been talking about our partnerships and our collaborations that we have with the with the Well Woman program. And if you're looking at our current slide, you'll see many of our collaborations. Obviously, we work very closely with the American Cancer Society. We've worked with a number of faith-based organizations. In terms of community-based organizations, we've worked with the Milwaukee Consortium for Lung Health. We've been working with them for years. And of course, the UW Carbone Cancer Center, the Cancer Health Disparities Initiative. We have a huge initiative with the UWM College of Nursing. Right now, one of the things that they're doing that we think is just really great is that they're providing virtual health education on related to cancer prevention and control, along with some education on other chronic diseases. We also work with the Wisconsin Association of Free and Charitable Clinics, and that is the association, obviously, that many of you may be familiar with, where there may be a free clinic, a small free clinic in your community. It might be in a church, it might be in a community center, it might be a clinic that's open once or twice a month. But what we do with them is we know that because they are seeing individuals who, for the most part, have no resources to pay for health care, we have been working with them to ask them to provide education on the importance of breast and cervical cancer screening. And then as they identify women who may be eligible for the Well Woman program, they can then refer those women to our coordinating agencies. We, of course, work with the Breast Cancer Task Force, also with the Wisconsin Intertribal Pink Shawl Initiative. They work with the tribal communities all over Wisconsin. They do a great job when it comes to the importance of breast and cervical cancer screening among Native American women. One of our other partners is the Wisconsin Women's Health Foundation. Again, we do a lot of work with them, and I should point out that the Wisconsin Women's Health Foundation, one of the things that we do with them is that we utilize their information and referral services, Well Badger. Some of you may be familiar with Well Badger, where, again, folks from around Wisconsin can contact Well Badger to ask all kinds of questions for referrals, and the Well Woman program is one of the entities that the Well Badger team refers women to, again, for breast and cervical cancer screening. We also have 3 patient navigation sites that I'd like to talk about for just a couple of minutes. I think a few months ago, you heard from our patient navigator who's with the Aurora Family Service. That would have been Dawn Shelton Williams. So we have 3 patient navigation components here in Wisconsin. The Aurora Family Service patient navigation component is focusing really on southeastern Wisconsin. Marshfield Clinic, of course, is focusing on central, western, and northern Wisconsin. And I should say that one of the things about our patient navigation services is that really what we really want the navigators to do is to work with women to help them to eliminate any barriers that they may have to getting breast and cervical cancer screening, diagnostic services, or even treatment. Let me talk about that for a minute. We know that many times, again, women may not necessarily have health insurance. The navigators can refer women who might be eligible for the Well Woman program, again, to our coordinating agencies. But the patient navigators also work with women who may have insurance, private insurance. They might have Medicaid, Badger Care. They might have Medicare. To help them eliminate some of those barriers that, even though they have a resource for paying for their screening and diagnostic services, there may be other barriers that are preventing them from getting the services that they need. We also have a patient navigator at the UW Carbone Cancer Center, and actually she is housed with the UW Breast Center. And her focus is really the 16 counties that make up the southern region of Wisconsin. So she does a lot of traveling. Well, I guess that was actually prior to COVID-19. And I want to take you back a moment to the Wisconsin Association of Free and Charitable Clinics, because the navigator who's working with the UW Breast Center and the Carbone Cancer Center actually does a lot of work with the free and charitable clinics in the southern part of our state. We want to make sure that we continue to provide services to women who need the services. As we said earlier, up to this point, we've provided services to more than 80,000 Wisconsin women. We want to continue to do that. And not only are we providing the breast and cervical cancer screening services, but with the patient navigation component and with many of our collaborations, we're just glad to be able to provide education on the importance of breast and cervical cancer screening. So thank you all for listening, and enjoy the rest of your day.
Great. Thank you so much, Gail. Gail is a great example of one of our members that is putting the plan into action. So as we look to launch our new Wisconsin Cancer Plan 2020-2030, thank you so much for sharing just how can we look to collaborate to achieve these outcomes? How can we look to reach out to different types of partners, not just our cancer organizations, but really knowing that there's such a variety of organizations out there looking to achieve cancer outcomes. So thank you so much. This is Beth Brunner, and I am jumping in just to help us at the end of our discussion today. And this is the time when we'd love to hear from you. We would love to hear your questions. If there are questions for any of our presenters today, we would love to hear if there are ideas or thoughts. And just to help us think through some of the things we'd love to hear from you would be these discussion questions we have on the screen. And if you're joining by phone, the three things we're asking is, how do you intend to incorporate the Wisconsin Cancer Plan in your work? What tools or resources would you find helpful to advance the cancer plan? And then kind of a personal question for you is, are you registered to attend the virtual summit in October? Because we definitely would love to see you there. So a couple of notes we have here is, Sarah, I just wanted to say a big thank you to our presenters today. So thank you, Dr. Stolle and Gail, for the great information. And then Deborah Nevels, we do have a thought that regarding the collaborative's new health equity goal to prioritize initiatives to benefit populations at highest risk of health-related inequities, is there a commitment to support community voices that address policies which are barriers to restoring health equity? Speaking to policies which are barriers to social justice and health equity specifically. So I don't know, Sarah, or if you feel you would like to jump in with that one.
Yes, I can do my best. So those are, I'm glad to say, kind of intertwined throughout the equity chapter 1. So one distinction between chapter 1 and the remainder of the plan is that, you know, chapter 1 on health equity focuses a little bit more on specific health equity issues that might not distinctly lie within the cancer control continuum. However, there are a lot of equity considerations and action steps throughout the remainder of the cancer plan that are featured throughout the cancer care continuum, as well as data. And so you will find action steps and specific things that point to that specific question about policies and barriers related to health equity. And so I think with a more thorough review, I'd be really happy to connect with you, Deborah, specifically on what action steps. But one that pops out to me right now is really within strategy C of priority 3 of chapter 1 is increase the co-development of health improvement activities with and for populations at highest risk of health-related inequities. And the first action step there is actually starts with value, community knowledge, and experience by incorporating practice-based evidence and promising practices. But there are several other things that tie to the social determinants of health, such as, living wage and things of that nature. So I think you'll be pleased with the health equity chapter at a more detailed review.
Thank you, Sarah. I would say too, with our health equity chapter being new to the plan, as Sarah mentioned, us looking at doing action planning around specific areas of the plan, that there will be more to come on health equity, that is definitely an intentional action plan we're going to see developed around that area. Not only how can we address the issues around health equity, but also how are we incorporating that into the other chapters of the plan. So this is, I think, an exciting area that we will hopefully be able to be a great partner to our members across the state. Dr. LeConte asked, can we walk through how you deal with emerging issues over the next 10 years, for example, a global pandemic? That is a very relevant question, right? So how will we walk through, deal with any emerging issues that come up over the next 10 years? Sarah, maybe I'll look to you again.
Great. So we have had, I think, in the end, the pandemic and the Black Lives Matter and work on social justice all happening, frankly, in the last few months of our writing of the Wisconsin Cancer Plan was an opportunity. I'm pleased in saying that a lot of the work in equity had already been established, but the work of the pandemic, like many of you and all of us, I don't think we really understood the exact how that would really impact us. And so we did quickly, through our peers and conversations with CDC, recognize that we perhaps did need to insert action steps related to the pandemic. And so we kind of did that work, hopefully for members already, without the need to request emerging issues and suggestions related to that. Through some of the action steps you'll see is just allowing for emergency preparedness plan or suggesting that health systems or clinics have emergency preparedness plans to allow for the safe cancer screening for individuals. We know now because of the pandemic, people that didn't get their cancer screenings, and now there's likely going to be an increase in later stage cancer diagnoses. Because of this experience, we want to make sure that there are plans in place in the future. So we did that work already, thankfully, but we recognize that hopefully no more global pandemics happen within the next 10 years, but we recognize that other things will happen, such as change in cancer screening guidelines and things of that nature. So, in the evidence. So that feature at the bottom of the cancer plan along the left menu, suggest an editor update, will be the opportunity for members directly to suggest changes that will then be referred and shared with our steering committee on a quarterly basis. But we also recognize that we might not be taking up on that offer on a regular basis. So we make sure that the steering committee, and this is actually Beth's important job in making sure that our steering committee is representative of the state, the professions and organizations to implement the cancer plan, but then also making sure that it's representative of the entire cancer care continuum and the chapters and goals that are set in place to make sure that they're keeping an eye on emerging issues and emerging evidence to incorporate into the cancer plan on a routine basis. So they will have a standing agenda item moving forward, actually, in the steering committee meetings that meet on a quarterly basis to ask that question and give the space to allow for us to have that dialogue and conversation. So hopefully that answers your question and provides a better overview of that to the membership and those participating today.
Thank you, Sarah. That sounded very helpful. And as a part of the team, I know how important it is to us to really keep evaluating as we are going through the next 10 years and making sure that the plan is very relevant and that we are listening loud and clear to our members and our steering committee to help guide us. So exciting to release, but exciting to see what unfolds over the next 10 years. I do want to make sure that we highlight the tools and resources that you would find helpful in advance of the cancer plan. So if anybody has any thoughts, I know as the staff team, that is an important piece for us to really know if we are providing the right resources and tools. So if you have anything off the top of your mind, I'd love to, we'd love to hear what that is today, but also know that that would be a great continuing item that you let us know as you're looking through the plan and using that button to let us know what your thoughts are. That would be great if you could help us with that. So if there's any thoughts. Allison, okay, so I'd love to see a resource that facilitates collaboration and partnership by highlighting the organization who could provide trainings or technical assistance around some of the action steps. So those who are interested in doing specific action steps can know where to get support. Research and intervention can help with implementing many of the increasing access to evidence-based tobacco treatments. So great. So we have the UW Center for Tobacco Research and Intervention. That is a resource. So thank you so much, Allison, for kind of highlighting. And we have, I think that will be an area you'll continue to see more of, how we figure out how to make sure we're helping organizations collaborate and bring partnerships together, because this is exactly what you're highlighting, is that you have a wonderful resource that people could use and reach out to you for. So thank you for that.
Beth, if I could just jump in as well and mention that as you know, the website and our name and the cancer plan have all actually been updated and released since March. And so we're in August now, and with the cancer plan revision happening, we are excited that our networking directory and the information that you enter on a regular basis to keep your information up to date as a member of the Wisconsin Cancer Collaborative, which oftentimes I call the commitment form, but it's a member information. That'll be an important tool for us in evaluation of the cancer plan to see where our members are putting their energy and maybe where we need to help generate more energy and action in certain areas of the cancer plan, because you're asked to respond on what areas of the cancer plan you're implementing. And with that, you're also able to share resources and information that you're working on that might be of interest to other people. And so that networking directory will be built out and detailed more with the release of the cancer plan, so it corresponds and aligns with the cancer plan. So stay tuned on that, and that might be a new idea in the coming months for a member networking webinar for us to feature that updated tool.
Thank you, Sarah. Any additional thoughts or questions from the group today? Well, know that we are here. If you have questions, there are ways to reach us through the website, or feel free to just reach out personally to us. We would be happy to discuss more, answer questions. But what we'll do is I will move us into next steps. So what we want to make sure that people have as their next steps is make sure that you have your calendars marked for our next monthly webinar. It is going to be September 10th at 10 a.m. This webinar will feature the Palliative Care Network of Wisconsin. So please, make sure you tune in and join us for that one. And then on October 8th at 10 a.m., we are going to be talking about putting the plan into action. So you'll have a chance to look through the plan, begin to use the plan a little bit. And then on October 8th, we're really going to talk about how we're helping to facilitate putting that plan into action, and hopefully get everybody very excited for moving forward and achieving some outcomes that we find in the plan. Then the last next step would be that we would love everybody to join us for our Wisconsin Cancer Summit. Normally our 1 day in person is now going to be a 2-day virtual event. It is going to be the afternoon of October 28th and the morning of October 29th. We are very excited to have a keynote speaker by Dr. Lisa Richardson, who is the director of the CDC's Division of Cancer Prevention and Control. She is going to help us understand where we're at as a nation, and then help us see really how we in Wisconsin will discuss how to put those strategies of our new plan into place. We're going to hear some wonderful success stories from our partners around Wisconsin, and we're going to give people the opportunity to network, because I think that is such a rich opportunity that we normally have at our summits. And so we are going to make sure we can still do that even in a virtual format. So thank you for joining today. If you have any questions, please reach out to us, and we will have the recording available hopefully later today or tomorrow. Thank you, everybody.